치료가 쉽지 않은 오십견, 회전근개 질환, 족저근막염, 테니스 엘보, 팔목 터널 증후군, 골절 분류압, 근막 통증 등에도 EMTT를 병행하여 시행 시 확실히 치료 효과가 더 증강되나요?
Tissues involved. So in frozen shoulder, we are aware that it's not only the tendons which play a role, but also the inflammation of the capsula, so the capsulitis. And it even mimics some fibromatosis like in Dupuytren's disease or in Lederhose disease, which I studied, as you might know. And that's why we, at the last ISMST meeting, had a very nice paper showing that even focus and radial shockwave could improve the outcome in frozen shoulders tremendously. And one of my first shoulder patients was exactly a frozen shoulder, where I did EMTT and focus shockwave, and found after 5 sessions of combination a much shorter duration of the pain, which is usually in frozen shoulders 1 year, 1.5 years. And she was able to reduce her pain within 2 months and to achieve 90-degree abduction after 6 weeks only. So we saw an acceleration of healing in frozen shoulder. As I mentioned, for tendons, for the shoulder tendon, we find a 2-fold increase in the efficacy of shockwaves and EMTT in contrast to shockwave alone. As far as carpal tunnel syndrome is concerned, and I'm a hand surgeon as well, so I'm operating these indications sometimes. I believe in the moment that the EMTT can add value to the known positive effects of shockwaves for carpal tunnel. We have more than 10 randomized trials for shockwaves, both radial and focused for carpal tunnel syndrome, but we have no trial yet showing that EMTT in addition is positive. However, there is case report, or there are case reports showing that EMTT alone can improve nerve healing, for example, on the shoulder. So I expect, and that's what I do in carpal tunnel syndrome, to offer the patients first, before the operation, shockwaves and EMTT in combination, 3 sessions, and they then wait, for example, 6 weeks or 8 weeks, depending on the nerve function, and then see how the nerve behaves. If better, perfect. If not, proceed maybe to injections, maybe to the operation. And so it depends on the tissues. So for the tendons, I'm sure EMTT and shockwave is very good. For the bones, we have case reports showing the very same. And for frozen shoulder and for the nerves, I have the gut feeling that it's good. However, we have to prove in the future that it is the case.
운동선수에서 급성으로 무릎이나 발목 손상 시 충격파 치료와 EMTT를 병행하면 통증을 감소시키고 치유 과정을 촉진시키고 유착 예방의 효과로 회복 기간을 단축시킬 수가 있는지요?
So I suppose that it's the same in South Korea like in Germany, that ankle sprains are very, very frequent injuries. And they are associated with pain, with range or deterioration of range of motion because of ligament tear and of the swelling. And we have very good clinical observations that both radial and focused shockwave can improve. And as soon as I started to apply EMTT in addition in these cases, and usually I apply it focused, radial and EMTT on a weekly base, 3 sessions after an ankle sprain, as soon as I can, I see a much more rapid reduction of swelling. I see a much more or much faster return to pain-free walking. And I still apply the orthesis for 6 weeks. However, it appears, at least with the ultrasound examination I'm performing every week, that the ligament healing is better when the combination is applied. This holds true for the ankle sprain. When I started in 2017 with the EMTT machine, the prior one, I myself accidentally had a knee luxation when skiing. So my ACL, my PCL were torn, my fibula had a fracture, my tibia had a fracture, and the medial and lateral ligament were torn. So everything was done. and I received a single bundle ACL reconstruction by a former AGA president, and I applied EMTT on myself every day for 90 days afterwards. So in the early rehabilitation phase, I applied it every day. And I could ski again 1 year and 2 weeks later, and 1.5 years later, I ran New York Marathon again with the same knee. Sure, we do not know how much EMTT is needed, but at least my knee healed with the help of EMTT quite tremendously.